911 Global Meds Disclaimer. This video and any contents herein are posted on this YouTube channel of 911 Globe Meds for informational and educational purposes only. Please see the detailed video contents disclaimer and the copyright disclaimer in the text section below.
Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Penicillamine. Its brand name is Cuprimine. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe penicillamine. We'll then touch on an example of dosing and then finish it off with side effects. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So penicillamine is a chelating agent. It chelates mercury, lead, copper, iron, and other heavy metals to form stable, soluble complexes that are readily excreted in the urine. The mechanism of action in rheumatoid arthritis may involve improvement of lymphocyte function. In terms of indications or reasons we would prescribe this medication to a patient, well, we may see this medication used in the treatment of rheumatoid arthritis, as well as Wilson's disease and cystinuria. With respect to contraindications or reasons we would not be able to prescribe penicillamine, well, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to penicillamine or to any other component of the formulation. They would not use this medication during pregnancy unless using for Wilson's disease or some other patients that may have cystinuria. Penicillamine-related aplastic anemia or agranulocytosis would be a contraindication at this point, as well as rheumatoid arthritis patients with a history of renal insufficiency. Now for an example of dosing with penicillamine. So in the treatment of severe rheumatoid arthritis, we may see an initial dose of 125 to 250 milligrams per day taken orally. The patient would then increase the dose at 1 to 3 month intervals by 125 to 250 milligrams per day. For maintenance, we could see anywhere from 500 to 1500 milligrams per day, but the typical range would be between 500 and 750 milligrams per day. As with all medications, there are some side effects or adverse reactions that patients may experience while using penicillamine. We'll go over some of those here now. 5% of patients may experience a rash, while others may experience diarrhea, epigastric pain, a loss of appetite, or 12% of patients may experience a loss of taste. Nausea may occur in some patients, as well as an ulcer of the mouth. This can happen 7 to 13% of the time. Some patients may experience vomiting or myelosuppression, and 6% of patients may experience proteinuria. More serious side effects may be pancreatitis, liver failure, renal or kidney failure, as well as interstitial pneumonia. Alright everybody, that's all we're going to talk about today with penicillamine or Cuprimine. As always, I'm very thankful you took the time to come by and watch my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.